I'm Dr. Mark Savant. I'm an internal medicine doctor here at St. Mary's Medical Center. I'm a native San Franciscan, and actually, much like San Francisco, I'm multicultural. My father is European, my mother is Asian, and I've had my own private practice in San Francisco, and before that I was working in New York City. I'm very happy to be back in my hometown. I have a small private practice where I have an associate, Dr. Jean Kim, and we see a wide variety of patients. I like to see patients in my office and in the hospital as well. I like to stick with my patients when they get sick. And I'm also the team physician at the University of San Francisco. When I see a new patient, what I like to do is actually not have them fill out any check boxes or forms in the front office. I really like to do most of that myself because, to be quite honest, reading a bunch of check boxes doesn't make much sense to me. So what I'm really interested in is somebody's story, because when they tell me about where they're from and what they like to do, that actually makes a lot of sense to me, and I'll remember them. It also gives me some insight into how somebody is and how they live. So I really like to get to know my patients personally. And in that way, I feel I can treat them better. I also like to teach them and to incorporate. It's sort of like the Socratic method of teaching by asking questions. One of the things I love about St. Mary's is that it's actually a small hospital. I went to a small college, so my professors knew me. I knew a lot of people in school. St. Mary's is very similar in a sense that when I walk down the halls, I know all the nurses and the other doctors and the people who do the maintenance. It's a really nice community at St. Mary's. So I think it's a great place for patients to come because people tend to know you. First of all, it's a privilege for me for people to invite me into their lives and to divulge secrets and concerns and fears about their health. So I take a lot of care in addressing their questions. I also think that, again, people are very smart, and they don't need me to be sort of beating them over the head with things, but to really help bring them along and sort of accompany them on the journey which includes their health.